Class, hello, and welcome to this dog grooming session on external parasites. I will be your tutor, Big Owl. Today, we're going to look at fleas, ticks, mites. Parasite infestation on a dog's coat is detrimental to the dog's health and consequently its general appearance. Groomers therefore need to have an understanding of the common parasite infestations that dogs are susceptible to. First, let's look at fleas. Fleas are the most common type of parasitic infestation. Thriving in all climatic conditions, fleas are hardy survivors. They quickly adapt to develop immunity to treatments developed to eradicate them. Despite being unable to fly, they have no wings, fleas get around by jumping. They can jump as high as 15 inches in a single jump. The typical lifespan of a flea is 115 days when on a host, but dies within 48 hours of not being able to find one. Fleas multiply remarkably, mating within 48 hours of feeding. Each female lays up to 2,000 eggs before she feeds again. A groomer must diligently examine the dog's coat for flea infestation. Fleas are most likely to be found in warm and moist areas on the dog's body. For this reason, the areas to search on the dog's body are the groin, under the belly, and around the tail region. Another way to check for flea infestation is to run a flea comb over the coat. Black grains that turn red when moist found on the comb are flea feces and the surest indicator of flea infestation. Does bathing a dog help to get rid of fleas? While flea infestation can be kept at bay by regular bathing and grooming, flea infestation, once affected, cannot be eradicated by just washing the dog. Washing only removes the fleas on the surface of the coat. The underdeveloped larvae and eggs tend to stay attached, causing a relapse of infestation soon after the washing. Recommended treatments involve commercially available vet treatments like Program, Advantage, Biospot, Frontline Formula, and Advantix. However, these can potentially cause allergic reaction in the dog, and these treatments must be administered only after consultation with the dog's owner regarding whether the dog has any prior history of allergies. What about ticks? Can these be treated in the same way? No, the process for removing ticks is different. Let's look first at what a tick is. Hailing from the spider family, ticks feed on their host's blood. Ticks are carriers of a host of diseases and infections that are very detrimental to the dog's health, as well as that of its owners. Ticks, if found on the dog's body, need to be removed as soon as possible to prevent the dog from contracting any of these diseases. Some of the diseases related to tick infestations are babesiosis. This is a dangerous condition most often resulting in fatality. It is caused by a parasite of which the tick is a carrier. It is particularly insidious owing to the fact that often there are no early symptoms or warnings. Once contracted, it causes sweating, chills, fever, muscular pain and cramping. It also causes hemolytic anemia and the enlargement of the liver and spleen. Ehrlichiosis is caused by a bacteria named Ehrlichia. The tick is a carrier of these bacteria. Early symptoms include joint pain and swelling, fever, headache, nausea, muscular aches and pains, vomiting, and cough. It eventually leads to a drastic drop in white blood cell counts and increases the secretion of liver enzymes, which triggers a fever in the body. It also causes swelling of the brain and spinal cord, profuse bleeding and respiratory failure, causing death. Lyme disease. Caused by the bacteria named Borrelia burgdorferi, transmitted by tick bites, its symptoms are fever, tiredness, rashes, chills, headaches, and swollen lymph nodes. In advanced stages, it causes drastic weight loss, excruciating muscular and neural pains, meningitis, painful joint problems, and arthritis. It was first discovered in Lyme, Connecticut, around 1975, and it is treated by the administration of antibiotics. Handling ticks is a dexterous task that requires removing them without causing the dog any further consternation. While there are many old wives' tales involving using a lighted cigarette or match, nail polish remover, vodka, brandy, and other surprising alternatives, the correct way to remove ticks is as follows. You will need gloves, either rubber or latex, tweezers, a jar containing rubbing alcohol with a lid on it, flea and tick powder. Wear the gloves and scatter some tick powder on the tick you find on the dog. Wait for a few minutes before using the tweezers to clasp the tick. Do this as close to the dog's skin as possible to prevent leaving its head or tail behind. After this, pull at the tick. If the tick does not come off at once, scatter some more tick powder and leave it for a few more minutes, then try pulling it off again. It is important not to press on the tweezers when pulling the tick out, as this may cause the tick to bury itself even further into the dog's skin. After removing the tick, drop it into the jar containing alcohol. Wash the affected area around the dog's skin and check for any infection or rash. If there is any reddening of skin observed on the animal, it must be taken to the vet at once. Thoroughly clean the tweezers with alcohol. Never handle a tick, even a dead one, without gloves. Even though the tick may be dead, its bodily fluids are still capable of transmitting disease to you.
Oh my, it's the same as ticks.
No, although like ticks, they belong to the spider family. They are tiny creatures that burrow into the skin of their host. They are responsible for causing several conditions. Some mite-related conditions the groomer needs to be aware of are Shigella mange, caused by the red mite that also affects humans, causes walking dandruff that is generally found in puppies. Given that they are transmitted from animal to animal, they are found in large kennels, breeding establishments, pet shops, and other places that house a number of animals at a time. Treatment involves specialized shampoo, dips, and removing any previous bedding areas used by the affected animal. Demodectic mange, a mite infestation caused by the Demodex canis mite, which thrives on the skin of the dog. It usually causes the dog no discomfort, but it can cause the animal to become unwell. Groomers should refer this condition to the vet if defected, as there are few over-the-counter prescriptions that are effective in curing this type of mite infestation. Chiggers, also known as the trombiculite mite, they are generally found in warmer grassy regions such as summer meadows. The mite, on coming into contact with the host, buries into the skin of the host. They cause the dog to itch and cause discomfort. This condition is treated using ointments, anti-itch cream, and regular hot baths. Sarcoptic mange, a dangerous condition caused by the Sarcoptes scabiei canis mite. They are transmitted between animals, sometimes from animals to humans via dog grooming equipment. Great care needs to be taken by the groomer in ensuring that the equipment used to tend to scabies infected animals is cleaned thoroughly. These mites infest the regions around the ears, hocks, belly, and elbows. The resultant condition is characterized by crusty, itchy skin and severe hair loss. Scabies is a serious virulent condition that should not be left to over-the-counter treatments. Groomers must refer animals suspected of scabies infection to a vet for further diagnosis. Finally, we'll look at internal parasites.
But if they're internal, we as dog groomers will not see them, so how do these affect our work?
While it is true that internal parasites do not fall within the scope of dog grooming, they do have a marked influence on the health and therefore the overall appearance of the animal. Dog groomers should therefore keep a lookout for typical symptoms in case all their effort at improving the dog's appearance is countered by the internal infestation of these parasites. Dog groomers need to keep in mind, however, that internal parasites such as roundworms, hookworms, and tapeworms can easily be transmitted to humans, and they must wash their hands and implements thoroughly, especially if they came into contact with feces or contaminated soil from the animal. Hookworms, also known as Ankylostoma caninum, infest the small intestine of the animal, feeding off of the blood from it. Spanning between 1/4 and 1/2 inch in length, they are transmitted from the bitch to her pups via her milk or by skin penetration. Symptoms of hookworm infestation show up only during the advanced stages of infestation and manifest themselves as drastic weight loss, anemia, general weakness, and blooded diarrhea. Heartworms. Heartworm infestation is insidious as it does not have any visible effects on the animal's health or appearance in the early stages, but once established, they cause severe heart, lung, and liver damage, resulting in fatality. They are transmitted from one dog to the next by mosquito bites, much like malaria in human beings. Heartworm larvae. Heartworm larvae can incubate inside the carrier mosquito for as long as 7 to 10 days until the mosquito bites another dog, whereby the heartworm is transmitted to the new dog. Treatment is usually of a preventative nature based on a vet's prescription. Roundworms. Taxonomically known as Toxocara canis, they are the most common type of worm infestation found in dogs. Growing to several inches in length, they inhabit the stomach, lungs, and intestines, leaching off the nutrients that the animal consumes. They are transmitted from bitch to pup via her milk as well as through contaminated soil. They are also transmitted by their eggs, which are hardy and can survive in the ground for several years, transmitted to the dog as it is digging up a bone from the ground. Typical symptoms of roundworm infestation include vomiting, diarrhea, weight loss, and a degradation of the coat condition. Another characteristic symptom is a garlic-like scent in the animal's breath. Treatment is again of a preventative nature, with regular deworming carried out by a vet. Ringworm. Ringworm is a misnomer since it is not an actual worm but a fungal infection. It is characterized by the red rings it creates on the skin of people and animals. Ringworm is an extremely contagious condition. Children are particularly susceptible to it. Groomers must take care to use latex gloves on animals suspected of having this condition. Dogs generally contract this when they grow old. As their immune systems are weak, they develop round, scaly, hairless patches that are the surest telltale signs of the infection. It is transmitted via direct contact between animals as well as from the ground. Treatment involves administration of oral medication and ointment applied to the skin. Tapeworms. Taxonomically known as the Dipylidium caninum, they infest the large intestine and grow several inches in length. Typically, they are transmitted via fleas, where the dog swallows fleas as it is tending to an itch. Dogs can also contract tapeworms if they eat raw game or rodents. Tapeworms are detected easily as they appear like small rice grains crawling around the animal's anus. They cause weight loss and increased appetite as the tapeworm siphons all the nutrients the dog consumes, vomiting, sickness, and a deteriorating condition of the coat. Treatment involves preventative tablets or other oral medication prescribed by a vet. Whipworms. Taxonomically, Trichuris vulpis, these worms infest the intestines of the dog. They latch onto the intestinal blood supply, feeding off it. They can grow up to 3 inches in length. They are difficult to detect as they do not cause any early symptoms in the animal and do not often produce eggs that can be found in the fecal matter. However, once established, they are difficult to get rid of, cause weight loss, anemia, and cause the dog's coat to become dull and dank. They can also cause blooded diarrhea, a telltale sign of this infestation. Dogs contract this infection by consuming contaminated food or bones from the soil. Only preventative treatments are available, comprising of oral tablets and other specified oral medication. So, to summarize today, we have looked at fleas, ticks and the process of removing them, mites, parasites. Goodbye class, and good luck!